At Ventum Financial, we believe that sharing another person's story is a privilege. The people inspiring and activating others, role modeling what's possible, solving problems today, and building for a better tomorrow. Who is relevant is subjective, but what if we turn the dial? Leaning into the courageous leaders who quietly drive positive change. This is Relevant, where leaders, creators, and change makers share the ideas shaping business, culture, and the world, one conversation at a time.
Good morning, Don.
Hi, Dan. How are you?
Thank you for having me.
My pleasure.
Today, I'm interviewing Don Copeman, the founder and chairman of Harrison Healthcare for Ventum Financial's Relevant. John, thanks for having me.
My pleasure.
Harrison Health has had a very exciting history and an origin. I wanted to hear from you. What was your inspiration for building private healthcare?
Well, building private healthcare is one way of putting it. It's more building a solution to what I saw was a systemic problem in Canada when I first became a young father, which was really the first time I entered the primary healthcare system or experienced it. I started having my own health issues, but now I had children. They started having health issues, which is actually part of the story, the whole story, one of the motivations for starting Harrison. And as I experienced the primary healthcare system, I realized that it had a lot of issues that needed to be dealt with. And the biggest issue that I saw, at the very beginning, because I was in the healthcare industry, I just wasn't in the primary healthcare industry. But I got to know a lot of specialists and experts in the area who told me some very simple and frankly stunning facts about how our primary system was working. And foremost amongst that was years ago in the early 90s, governments cut back on enrollments in medical schools for doctors, and it created a doctor shortage for family doctors. And so because there's a shortage, they need to ration their time. So some of the key aspects of keeping a public healthcare system together were disintegrated because preventive healthcare was no longer being emphasized by family doctors because they were now just burdened with a lot of patients and per doctor because of their shortage, so that we had less doctors to go around. So they had to really focus just on disease care and not preventive care. And so that was one problem I saw. And so my specialist friends in the industry were explaining to me that most of their wait lists for certain specialties anyways didn't need to be there. Most of the people didn't need to be on their specialist waiting list because the doctors had so little time to do examinations and proper investigations at the primary healthcare level. They spent a lot of their day giving out specialist referrals slips. So now the specialist lists got long. And so the whole
pipeline,
right? It added up to a system where we were paying X to a family doctor, and then they were paying 3X or some other number 2X to a specialist, and that's just a fiscally dysfunctional formula for a healthcare system. But the most important aspect of that whole thing is that disease isn't being prevented. So because 80% roughly of all major chronic diseases can be prevented, and about half cancers can be. And because there's so little attention being placed on prevention in primary healthcare these days because of this shortage of doctors and shortage of professionals and lack of funding for proper preventive support, we get a lot of extra people in the emergency rooms and hospitals. And those are the most expensive aspects of healthcare. So if we could just turn that around and start preventing disease as the emphasis, all the costs could right themselves and we could have a much more fiscally sustainable public system.
Don, I can't help but notice how gorgeous the space is here.
Well, thank you.
It's aesthetically beautiful. It's very calming. How much thought came into how you would design the space for the customer experience?
Yeah, some people might look at this as an extravagance in some way, but it's not. It's about creating a calm environment for patients. And our core value at Harrison is compassion. And And we think a lot about it, and we think a lot about what is the optimal way to care for a person. And creating a calm environment, a lovely environment for them to come to is a part of the whole picture. It's much deeper than that, of course. It starts with the first time you talk to someone on the phone. Do they appear compassionate? Do they appear friendly? And so we're a relationship-based healthcare service here, and when you have a relationship with someone, and a patient sees real compassion, there's a tendency for them to then adhere to the health plan you put together for them in a much greater way than a person might normally in getting healthcare somewhere else in society. And there's actually studies about this. So you can actually. There's studies that say for like chronic disease management, for example, for diabetes management and for other conditions like metabolic conditions, that your outcomes can improve by 20 or 30% just by
Unbelievable.
feeling,
Wow.
yeah, just by getting the feeling that you're being treated with compassionately. So we're always searching for better and better ways to get better and better outcomes. And the simply setting up a beautiful environment for people to come in, making sure that everyone that comes into the Harrison organization is filtered for their innate compassion as human beings. Just that whole thing, the way they're greeted, the calmness, the respect that we give patients, again, a calm surrounding to sit in. It all contributes to care in a big, big way.
When you first discovered that there was such a gap in what it is our government could afford to do in the healthcare, when did you really decide that this was something that you could do differently? And how could you do it as a business? Because, of course, we do go into business to be sure that it's sustainable and profitable. But how did you decide you can solve for that problem?
Well, it's actually reasonably simple. What our model is all about is it's very much prevention focused. So what does that mean? Well, there is certain tests, examinations that you should be doing throughout your life. Many people don't do them on time. They forget about them altogether. So that's a big problem. We're addressing that problem. If you're a client here, of course, you don't have to worry because we know
You're watching.
We've got an eye on them. But at the end of the day, preventive healthcare is all about a lifestyle change. For the most part. So invariably, a client will get disease, a person will get disease if they're not doing certain things right, if they're excessive at certain behaviors or whatever. There's something in their lifestyle that's not right that's causing them to have a higher risk of disease. Okay. So having a doctor part of that picture and solving that problem and keeping them out of hospitals and emergency rooms, the doctor plays a key role, but other kinds of professionals play just as an important role. So I'm talking about people like registered dietitians, exercise physiologists. Mental health is a huge part of preventive health because in lifestyle change, a lot of the big reason why a lot of people have problem with change is because they've got mental health issues, stress, depression, anxiety, these kinds of things. So we need to solve for all those things. So all of those other professionals they're so key in preventing disease, they are not funded by the government.
Right.
Right. And so our service essentially is all about interlocking these wonderful other professionals with the physician care and creating a coordinated plan as a team, not co-locating these professionals like, oh, we have a dietitian down the hall.
Right.
We have an extra, no, they actually meet together and they create a health plan for our clients. And then they work together as a team to get the client to adhere to that plan. And if the client does, we will have prevented disease. So if they get to us early in life,
right.
At Harrison, they're in really good shape.
Of course. So start them young.
Start them as kids.
Yeah.
Because we have programs for children at Harrison. We have programs for teens, which is a big aspect of healthcare, a big issue in healthcare right now. Teens and young adults, they're under huge amounts of stresses that we've never seen.
I just want to ask, what are you seeing and what's been the impact for them in the teen?
It's just that we're in an interesting society where we're doing this all the time. And there's different levels of socialization that are just, they're transforming our society in such a bizarre way. Kids, I think, don't know kind of where they fit into it all, and they don't feel particularly optimistic, in my view, about where things are going. So they're feeling just abnormal amounts of stress. I mean, I remember myself as a kid. I had so much fun as a kid. There was no stress. It was fun, and there was all kinds of crazy, wonderful things happening. And now it's like everything seems a little dark. And that's just I'm giving you my opinion as a father who's experiencing this. So this is what I see. But it seems to be quite rampant.
It is a little discouraging for this generation. Affordability, geopolitical, environmental. There's a lot, but also the challenge of information. We're fed information at a rate that previous generations weren't.
Yeah.
You had the town crier, you had newspapers. So now we live in an onslaught of typically negative news. So of course that would affect them.
And news you're not quite sure is correct.
Real or not. Absolutely.
So they're very confused about it all.
Sure.
Right.
Interesting. So tell me, you've spoken about specialists and components where you're seeing growth and obviously change. When you think of where you started, really back in late 1990s to where you are now, what sort of evolutions have you seen, particularly in specialist care? So right now you're seeing mental health. Mm-hmm. If you thought 20 years ago, what was really the one that stuck out then? Because you must see changes over time of where it is that resources and support has been required.
Yeah. Well, I'll mention mental health again, because it was our first big revelation back in 2005, because we had this vision of being this wonderful preventive health prevention-oriented primary care organization, and we thought that was good enough. But it was only a year into it, roughly. We said, "What? We don't have a mental health team here?"
Yeah.
Because here we are trying to adjust people's lifestyle and get them to, to lose some weight or stop smoking or stop drinking too much or whatever the case may be. But they needed mental health support in order to effect that change, because they had underlying issues that were really exacerbating their problems. So that was the big revelation at that time. So we, of course, got into mental health in a big way back then, and I would say we're in a bigger way in
it's
2026.
just grown the need.
Yeah, we touch on some altruism in our organization, when we do come from an altruistic point of view. Like back in 2005, when we first started as Copeman Healthcare, we did what we did and brought this kind of quality of preventive healthcare to our community, because we really felt that we were going to solve its financial problems. Because if we could keep people out of emergency rooms, hospital beds,
it reduces the stress for capacity.
And specialists and specialist offices as well. Because one of the big things back then was, doctors had so little time, and it still happens. They have so little time with patients that, most of preventive healthcare and coaching, if you will, around preventive healthcare kind of gets pushed aside. Right. And they're giving out more and more specialist referral slips. And so the specialists are now getting choked up, and it becomes fiscally dysfunctional, because generally specialists are paid more than GPs, right? So, our job, and over the years, what we're trying to do more and more is keep people away from specialists. Because in a lot of cases, in areas like cardiology or pre-diabetes or diabetes prevention, we don't need a specialist involved. We have enough expertise within these walls with our kind of what we call expert family doctors, because most of them have some kind of specialized knowledge in medicine, and we work as a team in this environment. So we can really reduce specialists' demand in primary healthcare. So that's a really big one, and I think we're doing a really good job of that. Our people we're not referring all the time. We have to, of course, from time to time, but that's a big emphasis. But now, what our emphasis is how do we take all of what we learned about effective preventive healthcare? How do we make it more available to people? So we have a very high touch service here. So if you have disease, we're incredible at disease management and mitigating any further risks of that disease. So we're just excellent. And you need a lot of hands-on care. So this is a more hands-on service. But not everyone in our society can afford to have this kind of service and this kind of hands-on care, right? So we're increasingly using technology to develop applications that will be accessible to the broader community. And it reflects, again, our altruism as a company. We started out here to help the system. We believe we're doing that. And in a big way, especially as we expand, we're getting more and more exposure to more and more people. We just opened in Toronto, which is exciting for us. There's a lot. We expect to expand their
Big demand there.
Yeah, big demand. And Toronto has an interesting culture. It's a culture of assessment, because a business like ourselves or a service like ourselves has not been in Toronto. So in Toronto is very corporate centered, as you imagine. So. Sure. Preventive healthcare there is just seen as, let's do a test every year. Let's do a series of tests every year, and it's become a corporate benefit. And so the culture in Toronto we've found is just this assessment-based culture. But we like to say your disease doesn't wait for your next assessment.
Of course.
And if you really want to prevent disease and manage it properly, you need the kind of more hands-on, day-to-day service. And you need it for your whole family.
Of course.
Many people are in a position in their family where they've got young kids and aging parents. So this is happening a lot these days, including for myself and my wife. So a lot of those services in Toronto, they're not intergenerational. They're not servicing the young children, even the babies, as we do, babies, young children, teens, adolescents, young adults, aging parents, geriatrics, that they don't provide service that the assessment culture doesn't deal with that, right? And prevention has to start very early in life. So we're very most proud of our Harrison Kids and Foundations programs for kids and young adults, because then we're trying to get prevention as part of their family life, making sure that they're doing all the developmental stages that we're assessing those. We're assessing all their inoculations, any tests that they need to do early in life, and just following that right through for the rest of their life.
Journey.
And we just keep moving through different age appropriate programming for prevention. So it's Toronto is an interesting market. We're very excited about it, and they really need us to be there. There's a lot of people there that need this kind of service.
Don, knowing what makes Harrison Healthcare so special is the client experience and that journey that they're on and the management of that relationship. I know that IT was where you originated from, and that you're bringing technology support into your client offering and the client journey. Tell me a little bit about what it is that you're offering and where you see the future of healthcare combined with technology being.
Yeah. Well, you remind me of our core value, of course, which is compassion. And it just kind of, we hire people on the basis of their attributes, their personal attributes, and whether they fit in to our organization to meet our needs, if you will, of just pervasive compassion within the organization. It's so important. And being that core value, compassion doesn't only mean compassion for our patients, of course, it's critical, but it means compassion for our staff,
Of course.
Supporting each other, and means compassion for the community. So in compassion for the community is where our kind of technology comes in, because whereas this very how should I say it, very premier service that we offer, which is very hands-on, a lot of team members, a lot of time with your physician. This is simply not an affordable model in our society for most Canadians, right? So since the very beginning, I was an information technologist before I was a healthcare provider. And from the very beginning, back in 2004, we'd already started developing technology to support our primary healthcare clinic. But now we're looking at it in a completely different way. We're saying, how can we take what we've learned, about preventive healthcare and delivering compassionate healthcare, and bring it to a technology platform that allows a very meaningful prevention service to happen at a very low cost. so that we can get our expertise to more Canadians. So that's where I spend most of my time these days. So the short way of describing the value of the technology we're building, which is called CarePolicy, is that really if you register your newborn with a CarePolicy account, and they live to the ripe old age of 120 or whatever it's going to be.
Apparently we're going to be that old.
Yeah. We could be. Remind me to talk about longevity. From that, for the whole lifespan, okay, they will get a reminder, an electronic reminder for every test, examination, developmental assessment, inoculation they need for the rest of their lives. And and of course that helps support Harrison Healthcare's hands-on service as well. But imagine that for everybody in the world has one of those, right? So at least they're being informed as what they should be doing to prevent disease. And it's shocking to me that this technology doesn't exist in the world today, but anyways, it's here. In fact, we debuted it this week. So
this would really be the ultimate preventative care, that you have that touch point and that monitoring really in a technology service. Is that sort of supporting that belief that you have?
Yeah, well, it certainly supports our altruistic goals, because right from the very beginning, as I've said, we started this organization to help society. Like it just wasn't a business idea,
right?
We really wanted to do something positive in the world, if you will. And so our CarePolicy technology is going to do that for preventive healthcare. We've talked in the past about how important mental health is. So we also developed a technology we call MHAD, and mental health assessment technology, that allows people to self-assess, if you will, but using very advanced algorithms that essentially replaces a conventional, psychologist, a psychiatrist in evaluating people's mental health, which is great support for as a decision support system for family doctors. And so we've developed that technology. It was the first one we developed at Harrison about 4 years ago. It's now being validated by Queen's University, and we're working with Dalhousie University in the East to bring AI into that solution. So our mental health assessment technology is a gift to the world. We have no plans to commercialize it. As soon as it's ready for broad clinical use, we'll just make it available to people for free. So, but we know that mental health is just such a key component of physical preventive healthcare, because as we talked about, everything's connected. It's like your lifestyle, you need to do all the right things, which are difficult for people, but they're difficult often because of their stresses and things, right? So if we can deal with all that and give them a roadmap for a healthy life, and longevity,
yes,
then we've done a really good thing. And I like, there's so many people out there these days that are obsessed with longevity solutions.
It is the topic du jour.
Yeah, it is. And we like to say around Harrison that you don't qualify to talk about longevity if you're not doing all the basic preventive things, because you can take whatever pills you want to take or do whatever treatments you want that are supposedly going to extend your life. But if you haven't prevented the cancers, and if you haven't prevented the chronic disease, if you're not doing all the proper tests, examinations, and inoculations to primary healthcare, then you're getting ahead of yourself. So if you're a member of Harrison Healthcare, you're in good shape to talk about longevity, and we have longevity services and products as well. But we're proud to provide them, knowing that the basic preventive healthcare has been done.
Don, we've talked about compassion as being one of your core values, or the core value of Harrison Healthcare. Tell me how that translates to your people and your talent, of how you hire and how you retain.
Yeah, it's interesting. Hiring at Harrison is a big challenge, of course, because there's already a shortage of fine professionals, and we look for some of the best out there. But they need to have that secret sauce, They need to have that compassion as part of their motivation for being a professional, and it's easy to pick that out in our interviewing process. So we hire people that have that already, and then we just nurture it.
Right.
right? Because again, compassion, it sounds like it's a great thing for patients, which it is, but it's also a great thing for professionals, because the professional burnout is a real thing. Our professionals work really hard. Our doctors work really hard. And we're constantly reminding them that if they lean into the compassion, it'll help with their burnout, because they're doing great things for people. And just keep reminding yourself of that, right? And so we've managed to build a culture that started in 2005 that I'm just so proud of, because we have very, very few people that leave. They're usually for family reasons or other reasons. So we've been able to retain people. And a great part of the story is that I had to take a hiatus to ironically deal with my own family health issues at the time, back in around 2014. And so my original company, Copeman Healthcare, it was sold. And it's now owned by TELUS Health. And I had to stay away from the business for a while because of non-compete reasons. But when I came back and opened Harrison, which is named after my son, by the way, there's a reason why it was called Copeman. It wasn't because of me, by the way.
So
I have a relative that's
about
named
your son
Copeman.
Harrison.
Yeah,
How
and
that came to be.
Well, because we wanted to name the company with a surname, because we want people to feel that they're coming to like a family organization. They're not coming to XYZ Corporation.
Right.
It's not a medical corporation.
A human touch.
Yeah, the human touch. So that's why it was Copeman Healthcare at the beginning. But it's not me that it's named after. It's actually a relative of mine. His name is who is a really accomplished and very generous and compassionate man himself, from Ontario, and a prominent physician in Canada. So it was the easiest name to get legally, and because I had someone in my family that was an amazing doctor that was very compassionate, it was a good name. So the second time around, I just wanted the same thing. And Harrison has a nice sound. Harrison Healthcare had a nice sound to it. Harrison's the name of my youngest son, who had health problems when he was one of the reasons I had to take a hiatus. He developed some. He was born with some congenital heart problems that became an issue, and it helped open my eyes about the healthcare system in a big way. As did my first son that was born, who was severely autistic, and he was not properly diagnosed in primary healthcare at the beginning. So I had all these kind of family motivations.
Personal experience.
But Harrison had his own. There's a little story on our website about my son. He's a great guy, and he's going to come to work for us.
Wonderful.
He just graduated actually in health sciences from Queen's University. So he's going to come work. He's going to come work. Yeah.
So tell me for our entrepreneurs who watch, what would your piece of business advice be about how to get started and something that's had an impact for you?
I've entered the hardest business to do in the world. I really have. It's, imagine opening up a private primary healthcare service in the environment of Canada, the political environment of Canada. And at a time when health problems are increasing, there's still increasing doctor shortages. It's extremely difficult to find people, good professionals that will get the job done within the framework of our values and things. It's extremely challenging business. But I'm going to just repeat the word again, which is compassion. And I don't know how I think the word compassion applies to almost any business, that you have, is if you're generous in how you deal with your customers and your clients. And I know how well it works as when you're managing people. If you're compassionate about your staff and how you manage them and how you treat them with care. So I think if more organizations had compassion within their value set, their businesses would be more successful and more sustainable. I was saying, like, we were talking earlier about the management of our staff. Part of the ongoing story in starting Harrison was that when the community here heard that we were getting the band back together,
they rallied,
if you will. All of the previous staff from the previous organizations, some of them were now with other companies, some of them were with the new company that now owned the old Copeman. They all applied
That's wonderful.
Yeah. So we had, and of course, and a lot of customers knew. The community just instantly knew. Oh my God, the old Copeman guys, they're getting back together. We were as big as we were within a year. We were almost as big as we were when I left the company.
That's an incredible testament.
Yeah. So, and that's a culture. Yeah. It's a testament to culture. And so, when you have that kind of culture, you're a forever kind of business, and it's all based on compassion. It's all based on your values, right?
So, is there a piece of or an anecdote that you can share that you experienced in your younger years to now as a more experienced individual that's relevant still for you today, if you go back in time?
I was obviously brought up well, and I'm a very compassionate man, and so I'm grateful for that. So how I developed, and I went to medical school. I just studied for medicine. I didn't become a doctor, but I did go to medical school, and I wanted to do it for the right reasons, right? I would have ended up down in Peru somewhere in the Amazon or something like that, very likely in my life. But I have a very interesting inspiration that most people would find very ironic. When I first, we talked about how I first got into primary health care, identifying problems in our society, but at the end of the day, the preventive part of it was the big part of it. But guess who inspired me about that? Tommy Douglas.
Oh.
Okay, the founder of Canadian Medicare. Yeah. So he was my inspiration, because I would not have known that to start going down the path of exploring preventive healthcare if I hadn't heard it from Tommy Douglas's lips. So this is the man in 1971, the founder of Medicare, who was saying Medicare and a public funded healthcare system in Canada will not survive. I'm paraphrasing, but you can listen to the speech. We have it on our website, but it won't survive if we don't change to a culture of prevention.
Interesting.
And I saw that, but way back at the beginning of this whole journey, and I said, "Aha, he's onto something there," and he was onto something there, and it's absolutely true. Is that if we love our Medicare in Canada, I mean, we love it. We're starting to love it less, but we still are very proud of it. It certainly differentiates us from our southern neighbors, and that's always been something that we've held on to very, very strongly. But we want it to survive. We want it to survive, and we think we found the key. And there's some poetry in all of that. This well-meaning man, Tommy Douglas, created this Medicare system, and but it degraded not for any particular reason, because technological advancements, higher costs of professionals, higher costs of new treatments that are really expensive, that had a lot of research and cost behind them. So it wasn't his fault, but when it started to erode, he knew that prevention was the way to save it. So in jumps us. Labeled as a private healthcare system.
Right.
And we're really doing our part. And we're going to do our part in a big way in the future, right? And so we're here to save Medicare. And I believe we can.
Don, thank you so much for sharing your insights and experience with us at Relevant, Ventum Financial. This was a really insightful experience to learn about healthcare and how it is that you can help so early in one's life journey, as well as the importance of compassion and the integration of technology in the future. So thank you for having us here today.
It's my pleasure. Thanks for those kind words.